And Dr. Pearl, can you talk about, to the people listening that might not know, can you talk about what regenerative medicine is on how that differs shit from the standard treatments on the market today?
Absolutely. So let's say we were to do some of the standard treatments that include pharma with anti-inflammatories, whether it be Advil, whether it be higher levels, things like naproxen, Voltaren, or even some of the pharma gels. Voltaren gel is now over the counter and certainly much safer than ingesting some of the NSAIDs and having the potential for silent stomach ulcers. Also included in the standard treatments are steroid treatments, whether it be oral, which carry more side effects generally than injected, but injected have their risks as well. So if we inject the Achilles, we have to potentially be thinking about a rupture because you can temporarily weaken the tissue with cortisone. Now, is one shot enough to do it? Typically not, but it could. An orthopedic colleague of mine was injecting many, many times, maybe 12 injections into the foot, and eventually the tendon ruptured. There was some plantar fascia damage with the chronic visits that included an injection every week or 2 weeks. So that was just too much. So now with regenerative options, we're actually trying to upregulate or stimulate the body's own ability to heal. Now, a lot of people get confused. Are we using stem cells? Well, yes, there are in some cases stem cells available. Those would have to be harvested from your own fat or bone marrow. But in many cases, it is easier to just use donor graft. So we can use donor umbilical cord. There is also amnion tissue or placenta tissue that can be morselized. Immunogenic factors are removed where it's lyophilized or almost like freeze-dried, if you want to think about that.
Okay.
There have been some regulatory things with the FDA to say that you cannot overstate the benefits of some of these things, but we still know that they have effects. So just because there might be warnings for, let's say people were like, oh, we're going to get rid of lupus with these injections, which is a little preposterous, there are still good, sound clinical efficacy for these modalities with things like tendon injuries, wound healing, chronic inflammation.